I'm Dr. Sonali Rudra. I serve as the Service Director for the Breast Radiation Oncology program at MedStar Georgetown University Hospital. I treat primarily women with breast and gynecologic malignancies. So currently I treat primarily breast cancer patients. Some of the patients I see before they've had surgery, others I see after they've had surgery. So I see the whole range of breast cancer patients. There are many tools that we have to try to decrease the side effects of treatment. I think proton therapy is a technologic advance that will help us decrease the side effects of treatment. The difference between proton radiation and standard radiation is that it can decrease the dose beyond where we're treating. So for breast cancer patients, for example, where we're trying to treat the breast and chest wall, there is some dose that goes to the lung and heart, which is right underneath the breast and chest wall. With proton therapy, we can decrease the dose to the lungs and heart much more than we can with photon therapy or traditional radiation therapy. Our breast cancer patients have the option of coming for a multidisciplinary clinic. This means that they can see all of their necessary physicians on one day. We typically discuss the patients earlier in the week, and we know exactly what physicians they'll need to see, and we try to set up those appointments for the patients ahead of time. So it's nice for someone who just has a new diagnosis of breast cancer to be able to know exactly what their treatment will entail and what the steps are. So many of my patients are young women who are my age or my mother's age, my sister's age. So the way I view them is as a family member, and I try to treat them as I would want my family members to be treated. So I try to give them as much attention and care and dedication as I would if it were a relative of mine that was being treated under my care. The role of radiation therapy in breast cancer is to decrease the risk of a recurrence, which means to decrease the chance of the breast cancer coming back. And for some women, radiation can actually improve survival in breast cancer. After a lumpectomy, all patients are candidates for radiation therapy. There are some cohorts of women, some groups of women who don't need radiation therapy. However, the majority of women will be a candidate for some form of radiation therapy after they've undergone a lumpectomy. After a mastectomy, some women do not need radiation therapy. However, women who have larger tumors or tumors that involve the skin, chest wall, or lymph nodes are usually recommended to receive radiation therapy. When we treat breast cancer patients with traditional radiation therapy, we treat the breast and the chest wall, but there is low dose that goes to the underlying structures, like the lungs and heart. With proton therapy, we can control the dose better so that there's less dose to the lungs and heart. So I think for young women who have left-sided tumors, there could be a significant benefit with proton therapy compared to traditional radiation therapy. For left-sided tumors, sometimes we need to treat the lymph nodes, which include lymph nodes in the lower part of the neck, lymph nodes in the armpit or axillary region, and lymph nodes right along the sternum. The lymph nodes right along the sternum are sometimes hard to treat with radiation therapy because they're right above the heart, especially in left-sided tumors. In women who have lymph node involvement by the sternum, those are called the internal mammary lymph nodes. So women who have internal mammary lymph node involvement, we want to treat those lymph nodes to a high dose, but we're often limited because the heart and lungs are right underneath. So those women are the ones that could potentially benefit the most from proton therapy compared to traditional radiation therapy. In addition, young women, they have a longer lifespan, so they may live long enough to actually have an appreciable appreciable difference in their toxicity as a result of even this low dose of lung and heart radiation. There are other unique situations where we may recommend proton therapy for breast cancer patients. Those include women who have had previous radiation, women with genetic abnormalities that may make them more susceptible to the side effects of radiation therapy, or women with anatomic abnormalities in which giving traditional radiation might give them an unacceptable dose to the heart and lungs. There are side effects associated with radiation therapy, both traditional radiation therapy and proton therapy. I divide the side effects into short-term side effects, those that they feel during treatment and those that they feel long-term. So the short-term side effects of radiation are fatigue, skin changes, and maybe some tenderness in the breast or chest wall. The degree to which people feel them differs from person to person, but everyone gets some degree of skin changes, some amount of fatigue, and maybe some tenderness. I meet with patients once a week while they're on treatment to make sure that they're doing okay and address the side effects as needed. Long term, the biggest side effects are darkening of the skin in the area that we're treating and kind of thickening of the skin and soft tissues in the area that we treat. The difference between proton therapy and photon therapy is that potentially it could decrease the risk of toxicity to the heart and lungs, and potentially even decrease the risk of secondary malignancies. During the actual treatment, patients don't feel anything. It's invisible X-rays that are penetrating their body. So they are lying flat on the table, usually with the arms up above their heads. The machine rotates around them and points the radiation to the area that we're trying to target, and they don't feel, see, or smell anything during the actual treatment. And that is true with traditional radiation or with proton radiation. There are several institutions that have been treating breast cancer patients with proton radiation for a few years. They have published their results and they show that proton therapy is safe and effective and produces very similar results to what we see with traditional radiation therapy. The real benefit of proton therapy, especially in our breast cancer patients, will be seen, I think, 10, 15 years down the road when we can see whether or not patients with proton radiation therapy have improved cardiac toxicity or lung toxicity compared to traditional radiation therapy. And we have to wait a few more years before we get those results. Proton therapy cannot replace chemotherapy or surgery. Proton therapy is an alternative to traditional radiation therapy or photon radiation therapy, but it can't be seen as an alternative to chemotherapy or surgery. Surgery really is the definitive treatment for breast cancer. There may be certain instances where surgery is not an option, and in those cases, potentially radiation, especially with proton radiation, might be a good alternative because we can deliver higher doses of radiation safely compared to traditional photon radiation therapy. If it's an appropriate time to start radiation therapy, the first step is to do a CT scan in our department to plan the radiation treatment. And about 1.5 to 2 weeks after that is when you actually start your treatment. Once you start, treatment is every single day, Monday through Friday, over the course of 3 to 6 weeks. While you're on treatment, you meet with the nurse and radiation oncologist once a week to assess you for side effects and see how you're doing. And after you're done with your radiation therapy, we usually see you in follow-up every 6 months for at least the first 1 or 2 years. Radiation therapy is usually the last step of breast cancer treatment. Surgery is often the first step, but if you have a larger tumor or lymph nodes involved, sometimes chemotherapy will come first, and then you'll have your surgery, and then you'll have radiation therapy. If you're getting radiation after surgery, usually we start about 4 to 6 weeks after your surgery, but some patients will start up to 12 weeks after their surgery. After chemotherapy, radiation generally starts about 4 to 6 weeks later. Being a comprehensive cancer center means that you have all of your specialists here. For a breast cancer patient, they definitely have to see the breast surgeon and medical oncologist, oftentimes the radiation oncologist, but there are a lot of other services that they need. If it's a young woman with a significant family history, they'll need to see a genetic counselor. A lot of women who are undergoing mastectomy will need to see a plastic surgeon. There's social services available. We have a dietitian that's available. So it's not just the 2 or 3 main physicians that a patient will need to see, but if they come to a comprehensive cancer center, they have access to the physicians and all the other supporting services and supporting physicians as well. I think MedStar Georgetown University Hospital is a great option for a breast cancer patient to be treated because you have all of your specialists under one roof. And all the treating physicians really specialize in breast cancer. We meet on a regular basis to discuss patients' cases, and it's helpful when all the physicians have treated you because there are nuances to each patient and their tumor characteristics. And if everyone at the table knows your case, then it helps develop the best possible treatment plan for the individual patient.